Of all the things that have been said by President Donald Trump and his administration since they returned to office in January, from annexing Canada to renaming the Gulf of Mexico to occupying Greenland, perhaps the goal that has gotten its fair share of attention is what was said by Secretary of Health and Human Services. Robert F. Kennedy Jr. said he plans to identify the cause of autism by September. That announcement followed his support for a controversial study, one that's reignited decades-old fears and theories, some long debunked, others still being debated. And as Hunter Funk explains, it has left many in the autistic community and their families feeling, well, unsettled.
Okay, there's a lot to unpack.
This is Karen Casso.
I myself am a neurospicy mom of two autistic kids who are going to be 15 and 11 later this year. And I've been involved in the local autism parent community for at least the last decade since we got our first diagnoses.
She lives it, teaches it, and coaches other parents through it. When she heard RFK Jr. launched a national autism registry and claims he'll identify the environmental causes of autism, she didn't hear hope, but rather a warning sign.
There's a multifactorial approach, I think, to what causes autism, and it's going to be very difficult to ever figure out completely what that causes.
She says it's not wrong to want to understand autism better, but it overlooks the urgent needs like more support, and it frames autism as a problem to be solved.
We're doing the best we can with what we have, trying to navigate life in a society that just isn't really set up to support our families.
Not only that, but Casso says the idea of a national autism registry.
It's terrifying. As someone who has relied on the Katie Beckett program for the better part of a decade, now it feels like that information that they have from all of the assessments that my kids went through, I'm afraid it's going to be used against us.
U.S. Department of Health and Human Services announced plans to develop the platform using Medicare and Medicaid records to investigate the root causes of autism, while the administration insists this is a real-world data platform and not a registry.
There are
Many remain skeptical.
ways that we can do research, there are ways that we can study things that remove that private health information so it is anonymous, so that people are getting the information they need to support the community and the population without being able to say, this person at this address has this diagnosis, these are their medical records.
Casso says, in a moment when families are feeling unheard and overwhelmed.
No one I know is okay. What I think we all need is support so that we don't feel so alone, because I think everyone is feeling very alone and very scared.
And with roughly 36% of Americans enrolled in Medicare or Medicaid, this research platform could potentially include sensitive health information from a large portion of the U.S. population.
It's hard to find anybody out there who took this statement by RFK Jr. that he's going to find a cause to it in September. By September. I mean, who took that seriously?
I think most people think it's an overreach, but also, yeah, not realistic. There's so many factors that go into this.
Right.
It was hard to comprehend.
And different variations. I mean, the reason we're seeing it more is it's only been recently, in the grand scheme of things, something that's been able to be diagnosed a certain way.
Yes.
So that's why it's kind of showing up a lot more than we used to.
Correct. And also mentioning people are born with it. So what environmental factors? Was it the mother? There's a lot of questions.
Yep, that's exactly. All right, thank you very much, Hunter.